In the mirror, I'm very conscious of the fact that my gums are very large.
What we're trying to do is expose that gum so your normal teeth are shown through.
I am a little nervous.
If you feel pain, you gotta let me know.
We're ready for part 2.
All right.
You excited?
I've never had an implant before. I'm a little bit nervous about it.
The worst part about the procedure really is the water.
Well, I'm young enough where I still want to eat, so I decided that it's time to get an implant so I could go back to eating steaks on both sides of my mouth.
Take that out, bite down. There's hardly anything to grab onto because of the fracture on this tooth.
I fractured one of my teeth completely off, and I've been living with it for 6 months.
By seeing the infomercial,
The match is perfect. Turn towards me, pretend you like me, bite down. I love
it
you.
looks so easy and the people look so relaxed. I would like to get a job here.
I'm Dr. Rubenstein.
And I'm Dr. Wang. First pilot hole. Together, we run SEDA Dental.
I've been doing this for 15 years. I love what I do. I make people look good and feel good.
I've been practicing for over 12 years now, and I've been specializing in periodontics and implant dentistry. We place the actual implant.
We provide the highest possible care using the best techniques in today's day and age.
Allison came in. She basically had the gummy smile. Our technical term is the altered passive eruption. Right now you have short little teeth, but you don't really have short teeth. You actually have normal sized teeth. And what we're trying to do is expose that gum so your normal teeth are shown through. So you will have less of that gummy smile or that pink smile. You'll have more of a whiter smile.
I have an 11-year-old niece, and when I saw her recently, she was like, "Aunt Allie, why are your gums so big and your teeth so small?"
It's not something that's pathological or harmful with the condition that she has now, but it does present a cosmetic concern.
I am a little nervous, and my anxiety is through the roof.
Feel a little bit of that?
Ian, nice to see you.
How you doing?
I'm doing great, thanks.
So back in Europe, I went to several dentists. I had some headaches, sinus problems, and nobody was able to figure it out what was causing all that. Dr. Rubenstein was the man. He discovered it and he fixed the problem.
Had a few fractures, okay, with a history of these root canals that were up there. And the worst part about it is you started developing infections, which we see in the x-ray. And these infections, they spread upward into your sinus. So we extracted the teeth, we cleaned out the infection thoroughly. As soon as we took everything out, and guess what? Everything disappeared. He was smart enough to come to a dental office thinking, you know what, it might have something to do with my teeth. So this is the most recent x-ray of where you are. You have all the bone graft that we placed took. Your body responded amazingly. Not only did the bone graft take, but the headaches disappeared, the sinus infection disappeared, everything is just clear and perfect. And we're ready for the...
Better.
You feel better?
Oh, yeah.
Awesome. That's like music to my ears. That's what makes me happy.
A friend of mine recommended Dr. Rubenstein, and I'm really happy about it.
We knew we were going to be placing 3 implants on Ian from the beginning. An implant is basically a titanium rod that replicates or mimics a tooth that is extracted. If I take a tooth out of your mouth and you don't replace it, you will lose bone, guaranteed. Started the drilling process, and it basically, I took an x-ray to just show me exactly where I am and to make sure I'm exactly where I need to be in terms of where the roots are. There's no question we were using shorter implants because his sinus dipped so low. A lot of water again. Basically, open the area up gently without even exposing the bone through a special technique that we have. What I do now is I just take a look and see exactly where my implant is. Placed 3 implants, and it's exactly where the other tooth used to be. So I'm pretty much giving him what Mother Nature took away. Bite down gently.
I thought he was gonna do 1, but in the end, he showed me on the picture he did 3, and he was fast. They didn't hurt, no pain.
Correct. I love it. Good. Last one. At this point, the next step is really to wait. It's a waiting game. We have to allow his body to heal appropriately and allow the implants to take. And once they do so, we're going to go ahead and build on those implants by placing crowns and restoring them for the next bunch of years to come. So we have 3 very, very stable implants into bone that was not so great before, and now we have a very, very healthy situation. Once you heal, you're gonna have teeth for the rest of your life. This is it. It's absolutely perfect.
Very good. That's what I want. Thank you.
My pleasure.
I'm gonna have to thank my friend for the recommendation.
Thank you. Awesome.
It's a very good place to come.
So what we're going to work on is basically from your canines to canines.
Initially, I'm told I'm going to be very swollen, so I don't see too much of a difference initially.
Do you feel any of this?
I really don't know what to expect. I don't know.
Well, she wanted a better smile. She wanted a smile that people didn't make fun of her. Well, let's expose that.
I was very self-conscious of it before. And when your 11-year-old niece points that out to you, you know that you have to do something about it.
She can actually have a normal smile. Just by exposing this, the initial stage was after, I'd say, towards the beginning, middle of the procedure, after she realized there wasn't going to be much pain or discomfort involved, she became more relaxed. Reduce or prevent any.
I'm laying there and all I can think about is that I just hope I'm doing the right thing.
Do I expect a little bit of swelling? A tiny bit.
Good morning. Thank you for calling SEDA Dental.
Same thing here.
Miss Nancy, come on in.
I was genetically blessed to get good teeth. I do some modeling and print work. It's very important for me to keep up my appearance in every way.
We have a maintenance program, and it is probably the most important thing we do. We have our hygienists meticulously clean their teeth and their gums. Our specialty is periodontics. So we find it extremely important to take care of the foundation, which is your gums and your bone.
Extremely important to take care of your teeth, but not just your teeth, the foundation of your teeth.
What I tell most patients is if you brush and you floss, you're not going to have any problems. You come in every 6 months, that's what we want to see. We want to see the patients. We want to make sure everything's looking good.
It's not about perfection, it's about being healthy, being clean, and being able to represent yourself. I know when I meet someone, I love to meet somebody and just see a beautiful, healthy smile.
Good morning. Thank you for calling SEDA Dental.
Our professional staff is ready to consult you about your personal dental situation, whether it's for a routine dental cleaning or a sophisticated dental implant procedure. So call us today at 877-987-4321 for your free x-ray and personal consultation in one of our convenient South Florida locations. For more information, visit our website at floridateeth.com and take the first step to a happy, healthy smile.
That sweet smile.
We'll cut the gums in a sense, and sometimes we'll even remove a little bit extra bone that's also underneath there. And then we reposition the gums to where it should be. She actually has normal sized teeth, it's just that her gums are covering parts of her teeth. We're gonna do a basic procedure, we call a gum lift, so that we can expose her teeth so she can have a good, proper looking smile. You'll see from now until, let's say, a few weeks from now, where it's fully mature. I think she's gonna really love it, and she'll love it more and more once the healing finishes up. And I know it's been a few weeks since our procedure, so how's your, is there any discomfort or any issues with your gums right now at this point? What about eating-wise? Hasn't really inhibited from that?
Nope.
Okay, nice. So let's take a look. Yeah, it looks really good.
I'm extremely happy that I came in. Dr. Wang was able to help me have a much better smile. It's amazing to look at myself in pictures now and see the difference of having a big girl smile.
Paperwork for you, please.
I fractured one of my teeth completely off, and I've been living with it for 6 months.
We pretty much have a fractured tooth, which is common with these type of posts that have been placed in root canal teeth. He basically has been walking around taking his crown in and out of his mouth for the last 6 months to a year. And it created a horrible environment. It became a bacterial trap where his gums were completely red, inflamed, had bad breath, he was uncomfortable. You get this bacteria around the crown which causes your gums to become very inflamed and they bleed more readily and easily. After this, it's a cakewalk. Our specialty is periodontics. You okay? Mm-hmm. You can close down for a minute. So we find it extremely important to take care of the foundation, which is your gums and your bone. A simple cleaning can save your life.
Periodontal disease is a direct link to heart problems and heart issues.
Make sure that the tissue is nice and tight and pink.
The most important things people can do at home to make sure their hygiene is where it's supposed to be: brush 2 to 3 times a day minimum, as well as flossing daily. That is a must.
Do like a circling motion where I'm massaging the tissue, and it's
These cleanings are a no-brainer. You feel better afterwards. So by taking out the bad root and by correcting the problem, all these symptoms go away. Okay. And that's our goal today.
He's going to remove the rest of the tooth and put in an implant.
The tissue here has to be handled accordingly because it's so fragile. The amount of gingivitis, which is inflammation that he had there, makes it so fragile that if you touch it the wrong way, it's going to rip. This is a very gentle process. And you actually have to wiggle it out. And that's pretty much what we're doing now. There's hardly anything to grab onto because of the fracture on this tooth. I'm showing you the technique now. Don't try it at home. Just a lot of pressure, right, Jer? Mm-hmm. I'm not hurting you though, am I?
No.
Good. We got a boy.
No pain. I feel great. Don't feel any nausea.
Now, there's all different types of bone grafting material, but this is the best stuff money can buy here. This will allow him to heal real well. That I promise. It's already healing because his tissue's pretty happy in terms of us getting that tooth out. Could have been a lot messier, that's for sure, because you never know what to expect with these extractions on fractured teeth. Pretty much copying Mother Nature. I'm not reinventing the wheel here, so I get the exact same angulation as his body wants for that implant. And this should last him for the rest of his life. Joe, are you okay?
I'm fine.
Good. I got to get him home before 5. He's having dinner with his wife. Jerry, we're almost done. Jerry, you can see right here, this is your implant, which is basically the rod that I was telling you about. It's sitting exactly where your root was. As soon as that heals, we're going to put a crown over it. And again, this is going to last you for the rest of your life. It's perfect.
It's good.
It's perfect. Not good. There's a difference. That's perfect. Good job.
No pain. I feel great. The hardest thing was just showing up.
Hey Mark, how you doing?
Good, how are you?
Nice to see you again.
You?
Excellent. Mark came in, originally had a tooth that had a root canal, old root canal and crown. It had a fracture and he was in pain, so the tooth had to be extracted. There's no other way of saving it. And we had that taken out, and now we're doing, and the bone was grafted, and now it's healed for at least about 2 or 3 months already.
Right.
So today we're gonna do the implant procedure.
Well, I'm young enough where I still want to eat, so I decided that it's time to get an implant so I could go back to eating steaks on both sides of my mouth.
And what that entails today is we're gonna numb you up a little bit and open a tiny little hole. First pilot hole for the implant. When you do the implant procedure, we're making the sizes for the implants. We go sequentially with the burrs.
You know, coming in, I anticipated at least some kind of pain or discomfort, but not really concerned about it because I knew the doctors.
In terms of biomechanics of what I enjoy, is a lot like engineering or building a bridge, except I'm working in people's mouths. Now we're going to slowly place the actual implant in there. Place the implant in there, bite down, call it a day, and finished.
Good, open.
15 minutes at most. Perfect. Because we do have to wait for the anesthesia to kick in. So everything looks great. How's it feel?
Great. I really, when you finished it and said you were done, I really didn't think that it was done. I said, there's no way it was that quick and painless. I didn't feel anything. When the doctor said it was over, I was like, that's it? You're done? We're finished? He said, yeah. No. Awesome.
I broke a tooth. I was told that I needed an implant, so here I am.
Hey,
Bill's been a patient of ours for 8 years. I'm gonna throw a little light on. Excellent. He bit down on the wrong thing. Good look. And broke more than half the tooth off. All right. Not only below the gum line, but below the bone level. You broke what we call the cusp of the tooth off. So the whole half of the inside of that tooth is sheared off.
But it's got to come out. I'm not eating normally.
That fracture is so far below the gum line, I can't save it. I'm gonna gently put this numbing cream.
I guess I'm like most people. Of course, there's an element of anxiety when you're going for a procedure like this.
You have to get below the fracture line. You comfortable, my friend? Yeah.
But I know I'm in good hands.
Notice the tooth moving. You do things slowly, efficiently, and in such a manner that you preserve all the bone around it. Got it. Bill is an outstanding patient. He's a super nice guy, and it's just so easy to work on him. I had to kick him in the shin to say that. Bite down all the way. Open once more, I'm sorry. And once I knew I had adequate bone around, I basically placed one implant. And again, it's exactly. Got excellent stability. Tooth was, in terms of positioning.
I expect to walk out of here feeling as good as, or if not better, than when I came in, knowing that I'll be able to chew normally.
The implant is exactly where it's supposed to be. It was where the tooth was, which is awesome. I got a little additional depth, so it's a nice long implant. It's wide, just as wide, if not wider, than the adjacent teeth, and it's going to allow us to put a crown on that tooth that is going to be simply perfect, and it's going to last him for the rest of his life.
I've had no discomfort throughout the entire procedure, and when you have to have something like this done, this is the place to go.
Hope you enjoy my artwork as much as I do.
I do. You are a master craftsman.
Thank you. If someone's a patient for 8 years, I feel like I'm doing something right for him. At this point, he's family.
Yeah, that's excellent. Thank you.
My pleasure.
Anytime.
I am happy. What can I say? This was really a great experience.
We're going to make the infomercial into a reality today.
That's good.
Are you excited?
Yeah.
Match is perfect. Turn towards me. Pretend you like me. Bite down. I love you.
I would like to get a job here, working from, then I can get all my teeth done.
I'm an actor, I'm a lifestyle model, and I'm also a spokesperson, so my teeth are a very important part of my work. Part of a healthy lifestyle is eating properly, exercising, and taking care of your teeth. So I make sure to go to the dentist and get regular dental cleanings. I floss because I know that's important for my heart, and I eat healthy. I eat fruits, I eat vegetables. My smile is my calling card. It's my best accessory.
At SEDA Dental, we're able to control your aesthetics and feel more comfortable on a day-to-day basis, which is truly amazing.
I recommend them highly to everybody. Some of my family members and friends fly in from all over the country to go see them.
Never even have a problem getting an appointment.
That I'm so happy with, and I recommend it to anybody.
It was a 12 on a scale of 1 to 10.
Just come in and leave happy.
It's extremely important to take care of your teeth, but not just your teeth, the foundation of your teeth, meaning your gums and your bone, because once you take care of your foundation, things can last almost forever.
Well, my parents were very insistent about my taking care of my teeth since I'm a child, so that's why I'm happy that I have the smile that I do today.
Good morning. Thank you for calling SEDA Dental.
Our professional staff is ready to consult you about your personal dental situation, whether it's for a routine dental cleaning or a sophisticated dental implant procedure. So call us today at 877-987-4321 for your free x-ray and personal consultation in one of our convenient South Florida locations. For more information, visit our website at floridateeth.com and take the first step to a happy, healthy smile.
That sweet smile.
Hi, Eileen. How are you?
Fine, how are you?
We're going to make the infomercial into a reality today.
That's good.
Are you excited?
Yeah. I have a tooth on the side here, and it wasn't permanent, and it broke, and it was always falling out.
Eileen's been missing this tooth for a year. She saw multiple dental implant specialist in the Northeast and had several surgeries already.
A lot. Let me try it on you now.
At this point, she needed to fill the space because she's been walking with a flipper, which is that removable tooth. She came in to have an implant placed so we can give her something fixed and something that just stays in her mouth permanently. This shows exactly where my implant's going.
It seems like how he was showing on TV that it would be much easier and painless.
In the past, they would actually take a hammer, and she kept referring to that because that was a nightmare procedure. Just imagine someone taking a hammer and just banging to expand the bone instead of using the drills or the techniques that we have today. But no matter what, you'll walk out of here with a tooth today. So she's flying in for 1 day to get a lot of work done. She needs a bunch of implants. So what do you plan on doing?
As much as possible. Let's get as much done as possible. Yuna's problem was she came in with her anterior section of the bridge. Those teeth underneath that bridge, some of it was root canaled and some of them were just fractured, meaning they were broken down. What I'm going to be doing today is I'm going to be taking out her front teeth, which it's going to be amount to about 7, let me see exactly, 1, 2, 3, 4, 5, 6, 7, 8, 9 teeth in the front. They're basically an old crown and bridge. It's been over 15 years old and she's had everything done to it. And now they're breaking down and there's no way to save it. So this is our last alternative at this point.
I have to have implants because the 2 bridges that I have, the big one at the left, it's broken.
My recommendation was you need to take these teeth out because there's no other choice. Otherwise, it's going to cause pain and infection. Now, when I section these crowns,
I didn't feel discomfort at all.
I had to take out those teeth and restore her or give her some type of prosthesis at the end. That's what she had before. Just going through some sectioning of the bridge. We're almost there.
I trust him.
All I got to do is just rotate it a little bit and voila. And she needed to have implants done. This was tougher because
I'm looking forward for my beautiful and the useful teeth.
We first started off taking impressions of her teeth so that we had some type of temporary teeth to be able to place right after the procedure. The one unique thing is that we did use mini implants as a temporaries.
I'm amazed about his skill.
What we're doing now is retrofitting. There's definitely a long-term benefit with doing the implants now than later. Now it doesn't fit. Just kidding. Bite down. The prognosis of these implants taking and lasting for a long term is very, very high. The one unique thing is that we did use mini implants as a temporaries.
New teeth. Excellent.
Eileen's been missing this tooth for a year, but she's been waiting for the right time to come and get the implant. The x-ray is absolutely perfect.
Oh my.
You're smooth, you're easy?
Yeah, it's a little pressure here.
But it's not a big deal.
No.
Nothing hurts?
No.
Okay, but the pressure, is it offensive or you could live with it?
Yeah, maybe a minute.
All right.
You know, pressure.
Pressure, okay.
But it seems like how he was showing on TV that it would be much easier and painless.
So I'll use a longer implant to compensate for the width. And again, I'm very, very comfortable using the implant, and I'm also comfortable telling you that it's going to last for 30 years, 40 years.
The underground.
She's had several implants done over the past few decades, so she's seen how implants have progressed and how the technology's gotten better. And it's pretty much the same size as my implants. So it's exactly where I want to be.
It was the easiest I've ever had for an implant.
Implants in.
Oh my, it's unbelievable. It really, no pain, fast, no knocking as they usually do. It was amazing. Now you can do my eyes while you're at it.
I'd have to numb you up above. You don't need it. You're beautiful.
Oh yeah, oh wow.
You don't need that.
He's adorable. He's really a nice guy. It makes me feel comfortable.
This is nice. Really nice. Over the past 20 years, implant technology has changed dramatically. It has become a predictable procedure that I can offer my patients at a 98% success rate. She knows what an implant's supposed to feel like when it's placed and when it's being done. Right, Eileen?
I know how to do this fast and it's so easy.
For me to offer someone the success rate like that is tremendous. It is truly outstanding. We're going to put the fake tooth in place, which fits perfectly.
And it won't hurt it to go in there?
Not at all. And big smile. It matches perfect. Turn towards me, pretend you like me, bite down. I love you.
It just was easy. I said I wouldn't have any more, but I'm so glad that I came. What his advertisement said on TV really was the truth. I'm amazed.
Nice.
Oh.
You could see it's exactly in between the natural tooth and the implant that you had previously. It's a little higher up, so I got more stability. So there's more bone grabbing, which I had to do because it was thinner.
Yeah, everyone's very nice. I mean, everyone, he's most likely a good boss.
This is gonna last you forever. It's perfect.
And my nose, it won't feel like it's in my nose.
I'm not touching your nose.
No.
I promise.
And he'd be easy to work for. I would like to get a job here, working for him, that I can get all my teeth done.
It's extremely important to take care of your teeth, but not just your teeth, the foundation of your teeth.
At SEDA Dental, we were able to control your aesthetics and feel more comfortable on a day-to-day basis.
Yeah.
Excellent.
Excellent, thank you. My pleasure.
Good morning. Thank you for calling SEDA Dental.
Good morning. Working out is not just for the body. It's all about the hygiene in your mouth as well. As I greet my clients, they want to see a nice, clean, professional trainer with a great smile as well, you know?
At SEDA Dental, we have 6 practices. They're located all across the Southeast in convenient locations. They're easy to get to.
You could feel that.
We cover all spectrums of dentistry, extractions, fillings, cleanings especially, implants, cosmetics. So we work in the broad spectrum of dentistry.
I love what I do. Not only have I met thousands of awesome people and maintained and create new friendships every day, I have people who keep coming back for my advice and for my treatment. It makes me feel amazing.
Depending on where you are, you'll be able to get to our offices within 10 to 20-mile radius.
A healthy smile also leads to great confidence. And as a trainer, I want to have the confidence.
Good morning. Thank you for calling SEDA Dental.
Our professional staff is ready to consult you about your personal dental situation, whether it's for a routine dental cleaning or a sophisticated dental implant procedure. So call us today at 877-987-4321 for your free x-ray and personal consultation in one of our convenient South Florida locations. For more information, visit our website at floridateeth.com and take the first step to a happy, healthy smile.
That sweet smile.